Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Today we're going to be going over flying because I had just completed a trip to Canada for family reasons. Let's welcome Dr. Sherman on the show. Hello.
Hey, no, how are you? Nice to be with you.
Yep, nice to be here. The COVID statistics as of now in the United States are as follows. There's 9 million cases of COVID-19 in the United States, and there's 228,000 deaths. Most notably, in the past day, there's been more than 80,000 new cases. And that's been the concern recently, is that there's been a lot of new cases every day. And that's kind of the parameter they use to determine when things are going bad. Especially concerning since it's about to be winter. The temperature is going down. People are going to stay in more. That's going to be an issue.
Yeah, you get the numbers going up, and then you get the lag time of hospitalizations and deaths to follow. So we don't want to see that. Hopefully, we can keep that down. But the numbers, the incidents, the new cases certainly have peaked up a little bit.
Right. So on my trip, I of course wanted to prepare myself as best I could, and so I wore a lot of things. Let's see. So I'm not wearing them right now because my headphones are kind of bulky when I try to wear straps, but I was wearing goggles and this mask on almost all the time. And then I had this face shield, which I would wear when I was moving through areas of people. So like I wouldn't wear it if I was sitting down at the plane, because if I'm not like moving through the air, then a face shield doesn't do as much. It's like a windshield. It's like a windshield for a car. If a car is being still, then a windshield doesn't do as much as when the car is moving. And because this mask has a valve on it, I did wear a surgical mask over the valve so that any air that I was exhaling wouldn't go out to everybody else.
Yeah, that's a key little move there. That's very, very responsible.
And you know what's very interesting is that on the plane from, I had two flights, a plane from Los Angeles to Vancouver and then Vancouver to Ottawa. So on the flight from Los Angeles to Vancouver, the pilot said to the plane passengers, like, "We thank you for wearing your mask." Like they would say stuff along those lines. But then the flight that was in Canada, they said how we require you to wear your mask. We will fine you if you do not. They were a lot more strict up there than they were down here. Little unfortunate. I mean, it could have just been the pilot, but
yeah, but I think that's the mindset almost. If in the two countries, the Canadians are all gung ho about trying to reduce the spread and will comply with mask wearing and rules, and in the United States, it's turned into a more political thing that most will, but some say, no, I'm not going to do it. I'm not. You can't tell me what to do, and you'll just kind of get that. You're not going to impose on my freedom mentality, which is, I guess, an American type of mindset in some parts of the country, and that just keeps the spread a little bit more alive than it otherwise would be.
Right. Yeah, and that's why there's been such a problem in the U.S. mostly because people just aren't being as precautious with this disease.
Yeah,
and that's kind of when the disease starts rising, is when we start lowering our precautions against it. Very cause and effect.
I mean, you can be vigilant 9 days out of 10, and then that 1 out of 10 you're not, and that 10th day and you let your guard down a bit, and that's when things get in there. The virus gets you, and it makes all those 9 days. What's the point? So
exactly.
You gotta be vigilant 10 days out of 10.
Exactly. It's that one. Doesn't matter if you weren't exposed for 9 days. If you were significantly exposed on one day, that's enough to get you infected and then render you something. Now you can transmit it to other people. And of course, there's a delay between when you have symptoms and when you're infectious, which is why they tell us to wear masks all the time.
Right.
Now, the last time I was on a plane, of course, like they usually give out like little things like pretzels. This time, however, I brought a care package with me because we got 2 on each flight. It has a lot of things in it. It's kind of like a goodie bag. One of the things that is most notable is that they handed out masks.
Now, this is on both flights, or just the one from
Both flights.
Okay.
Yeah, both flights were both by Air Canada, which I think is which is like why they're doing this. This is the mask that they were giving out. It kind of, even though it's not blue.
Yeah, it looks like your typical surgical mask, the one you were holding there.
It does. Yeah. In fact, I have the other one I have the blue one right here. So if I hold them up by side comparison to try to the material, it looks the same. The texture is the same. It looks like the weaving. Is that the right term?
Yeah.
The weaving looks similar. So hopefully these are in fact standard grade. Now, there was one thing that bothered me a little bit. So now, okay, before I get to that, what was really cool at Vancouver is that people at Vancouver were aware that the valves make these things insufficient.
Yeah.
So they would even say on the intercom to the entire airport that you cannot wear masks with valves.
Yeah.
And that did get problematic for me, even though I was wearing a blue surgical mask over it. There was this one security person who told me that I couldn't wear this mask, even if I had another mask on top of it.
Yeah.
Which I thought was a little confusing, because I figured that why should both of these layered on top of each other be less protective?
You would think the extra layer is the same as wearing it just over your mouth without there. I'm not sure what the to me, I do not know. I do not know.
It might have just been like on an individual basis because nobody else prevented me from wearing it, because I personally was not going to get on a plane without this extra layer of protection.
Right.
I was totally fine with wearing other stuff on top of it. But if that wasn't weird enough, my mom was wearing a mask like this.
Right.
And this is not a surgical grade, medical tested mask. This mask is basically just a cloth mask, one of the many cloth masks that are being sold. And they didn't prevent my mom from wearing this mask.
Right. That one still is a little porous.
Right. And that was a little
I'm not sure where they're getting their information. They may have done some research. The valve is it's a concentrated alleyway of things to go. Yeah. So maybe there's a little bit different with that than it is with normal mouth breathing. I mean, it's like
there could be
or something perhaps that doesn't have the same. It's a little bit more potent, if you will, than your regular mouth. So they want that out of the picture altogether.
Yeah. What's the science of how fluids move in the air? Is that just fluid dynamics, I guess? Because I was about to think maybe there's something going on here in fluid dynamics with
the valve,
how the air is moving.
Almost like a suction device, because there's no resistance there, and the air rushes to it, fluid and all, and it'll go through that at a little bit of a greater force then. And it's meant to be more comfortable for the wearer. But like I said, those masks were made for, fires and bad air quality, not pandemics.
Exactly right. And that's why these are not satisfactory.
Right.
I did see people at the airport wearing N95 masks that didn't have valves. Of course, those were allowed.
Yeah.
Which makes sense.
Yeah, those are the better ones. you know, but I guess they've done some research and things, so they have their rules. We want to comply with what the airlines are telling us. Um,
Exactly.
the
We
key
have
is to cover the mouth, nose, and get it under your chin. Um,
have to make sure it's like this.
yeah,
You have to make sure you're covering the nose and underneath the chin. That's the best way to prevent air from leaving your mouth.
right.
Now we have a question.
It moves through it.
Yeah, of course. Yeah, some air moves through it, and that's why you have to also social distance, because wearing this doesn't just prevent all of it from coming out. It's still there. It's just not going as far.
Right, right.
We have a question from the chat about, does Canada require a quarantine? Yes. Yes, they do. I am quarantining right now for 2 weeks. So that means you'll see me in this setup a second time, maybe a third time. And yep, they're requiring a
14-day quarantine.
Yep. 14-day quarantine. And everyone who comes over the national border, has to do it. Especially since I'm from Los Angeles, which is a higher risk location. And it's really good. It's really
How
good.
do they know? What do they keep a track on you if it's 14 days? They have like a GPS on you or something?
They don't have a GPS on me. And I thought we would have to install an app, but we didn't. Instead, they don't have like surveillance cameras, so they're not like being as hardcore as some other countries have been. Like I believe South Korea was using cameras. But here, a couple days ago, the government, or someone working for the government, did call me and asked me questions about my compliance, various different things. What's very interesting is that one of the questions they asked was actually, how do I get fresh air? I was kind of surprised that they were concerned about that, but it is a valid concern.
Yeah, I mean, it's important. And if you're quarantining it, I don't know. I guess the implication is you got to stay indoors for 2 weeks in a row, but you can't really do that. And I don't think they want you to stay inside 24/7, but they certainly don't want you to go out and about and be part of the community either. So there's an outdoor local, go to the yard or go around your neighborhood type of thing, I guess.
Mm-hmm. There are windows in this apartment that can be opened, so that's good.
Yeah,
now, of course, it is winter. It is cold here.
Yeah.
It was below 0 degrees Celsius. No, sorry, I just got a correction. It was below 0 degrees Fahrenheit here.
Really? No, that it's got to be cold. It's got to be warmer than that.
All right. Fact check. Anyway, so yeah, it's very cold. Having the window open is like, I personally am okay with it because I can just put on extra clothing.
Yeah, and that's nice to do.
And the heaters in this place are very good. So, getting fresh air is a very important thing. I wonder if it's going to be talked about later, because the levels, because fresh air does actually have like a noticeable impact on your mental performance. It's something that's not super researched though, so don't take my word as doctrine.
Right.
And let's see.
But yeah, it's that's the thing. I mean, the cold weather there is helping kind of mitigate the virus a little bit, in the sense that people are less likely to leave the house for non-essential, or not for over the summer, for example, there were some probably patio dining open, and now it's too cold to patio dine, so there's no restaurant going going out to them, or any other type of outdoor activities that you can do. So it's more of an indoor thing. Stay home, or just go to the grocery store and go back.
Mm-hmm. Right. I think this can this be like a double-edged sword, because of course people are going to be staying indoors more often, but they're also not going outdoors as often either. So like they're not interacting with other people, but they're also interacting more with each other. I guess it
Yeah,
just
that's what we
depends.
talked about in an earlier show. You're home alone, you get a little lonely. The mental health aspect of it,
Oh yeah,
the
that's very important.
there's the depression and the being alone part of it, or then there's the living with another person and getting on each other's nerves and anger management things. And this is for another expert, but like domestic violence and stuff like that comes on.
Right.
Or and alcohol use and drug use to just pass the time or whatever. I mean, it's a problem staying inside like this or being alone like this. So it's a double edged sword. So that's why leaders and governors and premiers and folks are trying to open things up in a safe manner for everyone. You don't want to spread the virus, but you don't want to be left at home depressed all day either.
Right. Yeah, and that's a very big. That's kind of like where all the debating comes from, I guess, is
Yeah.
because people don't feel good staying indoors, but at the same time, having the disease also is very detrimental and doesn't feel good to those who get it. So it's just that's why there's a debate, because mental health is very important.
It is very important. Therapists are booked solid through their Zoom calls because their clients or their patients are just having a tough time being alone, or without the as much human interaction, or a little depressed, and it's difficult to overcome that by yourself.
Yeah, and how how important is exercise to someone's mental health?
Yeah, very important. It's good for mental health and of course physical health. But mental health, you get good adrenaline going, good endorphins going. It's good for the brain. It keeps your mind. It's like an uplifting mood type of chemical up there, and that's important. A walk is good. Your indoor, activities are good. Indoor apparatuses, gym apparatuses have gone through the roof in terms of sales.
Oh yeah,
Treadmills and pelotons and elliptical machines are being bought up at big time paces to help patients, help folks go to get their exercise. Their gyms are closed. They want to do their exercise, so they have these. So I mean, it's a very uplifting. It's good mentally and physically.
exactly. Yeah, there's a lot of benefits to exercise, and it can be easy, I guess, to forget about it
Yeah,
since we're staying inside. And like a lot of the exercise that we get isn't like intended. Like we're not trying to exercise. We just have to in order to walk somewhere or carry groceries
yeah,
from a car. And all of that is very important to our health. And it's important that we try to bring that back when we're not doing it.
right.
Like you said, people are getting machines. Even you don't even need machines necessarily. You could
Yeah,
just
exactly.
do.
There's online boot camps. There's online exercise programs. There's apps that you can do certain exercises on your own. A 30-day workout schedule, and you can do this many jumping jacks, this many push-ups, this many planks. It gives you an outline of what you do, and it'll help. It's very helpful. Very,
Yep.
yeah. You don't have to buy a big piece of equipment. You're right. You can do it all
Hmm.
on your own.
It just might take a little bit of planning, getting used to, because it's also isn't it also important that you separate your activities physically?
Uh, in terms of exercise, or just
Lots of things like eating, sleeping, working, and also exercise.
yeah, I mean, you want to have a pretty much routine, regimented daily schedule. You want to dedicate certain number of hours to certain activities, and then leave one and go to the next. So you get a good sustained amount of time. Exercise for 5-10 minutes is fine. You need to do a good 20 to 30. Give yourself a good dedicated amount. Set it aside a day. Clear your mind. Keep it away from work. And then the same thing for work. Keep your mind focused on work. so that when you're done with work, you can break away and know that you've completed what you need to do. Then get on with the next thing, moving, cooking. Cooking's very therapeutic. Baking, things like that, keep people's minds off the stress. And so you kind of do that for a couple hours in a row. Good idea to, separate like you do. You do one activity and focus on it and do something else instead of multitasking and doing everything, because then you're not getting anything done, and then nothing
Right.
feels better after a while, and you're left with a bunch of incomplete things, that are not satisfactory, and you got nowhere else. You got nowhere.
We actually have a very important, not a question from the chat, but a very important comment from the chat. Vitamin D is even more important during the winter. And yes, because there's, of course, a lot less sun exposure to begin with, and you're staying inside.
Yeah, you're staying inside. It's cold in most places, so you're staying inside. Number two, the number of hours of daylight are less. You're not even going to, when you are outside, there's going to be less sun in the first place. So you need to take your vitamin D supplements. And we'll say it again, in the hospital, the patients who do better, it is known that they have higher levels of vitamin D in their system. So if you stock up on it in your body and take a supplement, then you're not less likely to catch the virus. But if you do catch it, you'll be better off with a higher vitamin D level.
Right. And is this I remember you saying the data on it is very good and that it's greater than a correlation. Correct me?
Well, it's a pretty high association. I mean, there's
A high
no
association.
association. There's ways to quantify those things.
That's right. There is.
But it's
Statistic.
a pretty good association, pretty good one to, along the curve as they measure, a pretty high correlation and association. There's no there's no cause and effect. So you just gotta look at the data and just kind of do your own conclusions. It's not like if you take vitamin D, you'll be better off because you had the vitamin D people and the no vitamin D people. You just had the people who did better and did a little less better, and the people who did better had more vitamin D. It was a retrospective analysis,
Yeah.
so that's how you use correlation.
Right. Like there's a possibility that they had more vitamin D in their system because they also exercise more often outdoors. Or maybe they had other aspects of their health that went unnoticed somehow by the research, but definitely it is not bad to take vitamin D supplements.
Right.
Very, very unlikely that you're going to hurt yourself by taking vitamin D. You're only going to help yourself.
Yeah, it's helpful.
I also have something else that I did take a lot beforehand, which of course, it's the zinc again. I took a lot of this before traveling. I say a lot, but it was like 2, and then like one extra one during the process, during the traveling. And one thing that I noticed too about this bottle is that it's got a lot of various fruits and veggies in it. It's very bizarre. It's a super long list of things like strawberry, green bell pepper, kale, cucumber, raspberry, ginger. Like I'm just darting my eyes around. It's a gigantic list.
Yeah, there's a lot of stuff, and it's hard for me to see it, but I see what you mean.
Of course, yeah. That's basically
the zinc. I mean, you can take the zinc every day. It's going to be helpful. It's most helpful. I'm doing a little research on this. If you start to feel the symptoms, it's most helpful in that moment where if the symptoms are just on the oncoming onset, they're likely to not stick or not, be as severe. You can take it every day leading up to that, or every day prophylactically. Also, there's no harm there, but you're going to get the most benefit out of it once you're starting to feel the onset of symptoms. And it doesn't necessarily mean they're COVID symptoms. Stuffy nose, sore throat, fatigue. You take some zinc and things will go quickly. But if you're taking zinc every day, then if the symptoms come on, then boom, you already got some zinc in your system.
Exactly right. Do you know what that actually that actually helps explain a little bit of the experience that I had with zinc, with taking the zinc. Now, of course, remember that a singular experience is not data. Dr. Sherman, you probably brought up research data on this phenomenon. But in my case, just as an anecdote, months ago, I wasn't always like compliant about the zinc. Like I didn't always take it every day.
Right.
However, I would of course remember to take it when I would feel a tiny like symptom arising, like the very beginning of a sore throat in my body, or a very light urge to cough. That would remind me to take the zinc,
Right.
and those symptoms would go away.
Yeah, and it's very it's the timing is key. So if you're taking zinc every day leading up to any symptoms, um, you're likely to have the zinc ready to go. Zinc is not going to prevent you from catching it. It's just like when you do catch it, it really blunts the effects of it. So taking it every
Right.
day, you have zinc in place. Whenever it hits you, you got it already. You know, at the early onset of your infection.
Can we
Uh,
say that it lowers severity?
yeah, yeah, lower
Lower severity.
severity and I guess you could say duration,
Yeah,
which is
duration of the
severity
condition.
too, I suppose.
Hmm.
But severity meaning how bad it is for that day, and duration is number of days.
So now because COVID-19 is starting to get a lot worse, the infection, the rate of infection is very high. Flying, of course, is very dangerous, and it's only going to get more dangerous because of the Thanksgiving break,
Right.
uh, which will probably be which is already very concerning to scientists. So, like, how do you recommend people handle, I guess, the Thanksgiving week? If that's a little too broad, though.
I mean, I know it's. I mean, this is a weird year. I would beg, or not beg, but I would say, no, let's just not travel this year. Stay home. So yeah, your
Right.
family and friends and mom and all them are far away, and you usually go. But it's one of those you can't fly before going to your mom's house. She's 80 years old, and you just can't do it. I would just say let's not travel in the airports and planes this year if you can avoid it. If
Right.
you can drive to driving is a better option. Driving along, ways 6 to 8 hours, you can get there in a
Yes.
day. That's certainly reasonable. But if you can avoid the airports and flying cross country for Thanksgiving, just probably not the year to do that. You guys did it,
Right.
but
Didn't really have much of a
you
choice
do
driving.
a lot, and
Yeah.
I'm just saying as a general rule, you're gonna. It's just best to not do that this year, and do a Zoom call during Thanksgiving and say hi and so on. But it's best to stay put. A lot of college kids aren't flying home for Thanksgiving, or if they do, they're
That's
staying
good.
home throughout the not only Thanksgiving but the month of December and their winter break in January. So that's a little bit different. They're not flying back and forth, to college, home, back and back and back. Um, but even then, they shouldn't. If you don't need to go home for Thanksgiving, I would stick it out at
Right.
where you are.
Yeah.
It's probably the best way to go. It's a little painful to do that, but I think it'll expedite the recovery process, which is what we're all trying to do.
Exactly. We have to remember that since this disease is starting, this disease is serious, especially since it's so easily transmitted. If you don't realize that you have it, then it can be really easy to, like we said at the beginning of this show, how just one time where you aren't being super precautious is the time that somebody else is going to get infected or that you're going to get infected. And that's
Right.
why it's important to be vigilant, because you really shouldn't take any chances. And that's how diseases spread, because you get it and then you might infect one other person that ends up infecting 3 people. And that's how these messes start. And
Yeah.
flying is very risky. You can, Now, I personally have not looked at the statistics for this, but is it safe to assume that at least one person on every flight is going to have COVID-19?
Well, the statistically no, because there's
Okay.
what 200 people on a plane, so
Right,
one in
right.
200 is a little high for what we've been seeing, but you just don't know. You don't know. So it's hard to assume that at least one person is. I don't know if you can do that,
Yeah,
but you got. I mean, you can assume it because you're going to protect yourself. But
exactly.
I think statistically, it's less likely that there's one than there is zero.
Right.
But you got to protect yourself no matter what.
Exactly. And that's the thing about being vigilant is that even if the odds are low, you don't want to be in that low odds scenario and suddenly have a problem on your hands that could have been avoided.
Right.
And that's what's so
Right.
scary about this disease is that it's like, of course, you can't see any disease. It's all microscopic. But this one especially, it's so easy for it to transmit uh, without symptoms, without real
Right.
knowledge that you're infected.
That's why I say this disease is so weird. It's nowhere, but
Yeah,
it's
it's a weird
everywhere.
one.
It's
Exactly.
like I'm fine. It's nowhere, but it's everywhere. It's all over the place, but you don't know where it is.
Right. Yeah. And that's exactly why you got to protect yourself all the time, protect others
Yeah.
all the time. All right. Well, I think that's a nice place to slow down and end off the show. Was there anything else that you really wanted to talk about?
No, I just the traveling's a very good topic today. The flights and the precautions. Um, hand washing. Before and after flying, or like that. I think they're limiting or not giving drinks or food on the planes anymore. So it's
They're not.
all bring your own or
Yep.
that kind of thing.
In this complimentary bag that they give you, they do give you a small water bottle. So
Okay.
they do give you water ahead of time, but they do not do service where they give you drinks because that is risky. Yeah, the most notable thing about this care bag was the mask. Everything else is like a pretzels, a napkin. Um, there is a bottle of hand sanitizer. That's
Okay.
very nice.
Yeah. So I mean, they're doing their job, and it's all individually wrapped for individual passengers. So only that one person touches it and handles it. So, they're trying to still give you the service that you're used to with making those accommodations and
Yep.
adjustments. Yeah.
All right.
I give them
Well,
credit, and that's good. And just be safe out there, and
oh yeah,
wear those protective, personal protective equipment, and you'll be okay.
exactly. All right. Thank you for being here on this episode of Ask the Doctor with Dr. Sherman. If you happen to be in the LA area and you want to schedule an appointment with him, we have his email for his office in the chat as well as his phone number. Not his personal phone number, but the phone number of the office.
Yeah, with you.
Yes. And if you have any questions for us that we couldn't get to during the live show, you can email us at myworldsciencetv@gmail.com. And we do these now at 5 p.m. PST every Thursday. And until next week, stay safe.
Very good.